90-90 hip lift. So we're gonna use the wall to kind of help us go through that hip lift position. And the 90-90 is relative to 90 degrees of knee flexion and 90 degrees of hip flexion. What this does is this puts us in a neutral position to where if I look at my tailbone all the way to my head, I'm in a straight line. And this is just a position for us to kind of go through some parasympathetic breathing drills to kind of calm that nervous system down and to get the diaphragm to breathe. We use this a lot of times paired with other movements where we're moving our extremities to try to get motion at just those extremities. So often you'll see this paired with like a dead bug as just an example, because then we're moving away from the wall and maintaining that same trunk position, and then we're moving our arms and legs without moving our trunk. So we go to the wall, and you want to get pretty close to the wall, and then when my feet are on the wall, what you should see is pretty close to a 90-degree angle with my knees, and then a 90-degree angle with my hips. Now from here, my feet are about hip width apart, and then I like to cue to push into the wall just slightly, and then pull down just slightly. When I do that, I'm tucking my tailbone under me, right? So then another way to think about it is if I were to take my kneecaps toward the ceiling. I'm gonna exaggerate it so you can see in the video. But the idea is I'm taking my tailbone and just picking it up just slightly. I can't quite fit my hand under there, but I could definitely slide a piece of paper under my tailbone. Then I like to take my right hand and I like to go to my belly button, and then I like to take my left hand and I put it on my rib cage. And the reason I'm doing that is I'm trying to breathe in through my diaphragm, meaning my right hand, and try not to have my upper chest rise the entire time, because the upper chest is going to be some accessory muscles of inspiration and expiration. I want to focus on my main one, which is my diaphragm. So kind of hand on the upper chest, right hand on the belly button, and I want to breathe into just this right hand while maintaining that position of knees bent to 90, hips bent to 90, slight pressure into the wall, slight pulling down, and my tailbone is just high enough to where I could slide a couple pieces of paper under it.